Hey, everybody. Fascinating and important chat today. Most people think of LED as bulbs, but SunPower LED is turning them into a frontier of healing, pain relief, performance, and more with red and near infrared photobiomodulation. Yes, that's a new word for me. Um, a quick note, this isn't a sponsored or paid promotion in any way. Irma and I actually used the product at CES last week ourselves, thanks to Dr. Hayman here, and wanted a real conversation about the science and real world impact behind this technology. Tom Hayman, how are you? Irma.
Excellent. Excellent. Thanks for having us on.
Great.
Well, thanks for being on the
Thank
show.
you.
Let's start with you, Tom, for introductions. This is your baby. This is your mission in life. Starting from the top, what problem were you personally trying to solve when SunPower LED came to life for the first time?
Well, Evan, I got to say, I wouldn't have even believed that light could do anything that way on the body. I was very much a skeptic on some of the stuff I saw out there. This is 18 years ago. And it was only because I ended up meeting a doctor for my wife. Now, just prior to that, I had on the market a dental device to cure the white fillings. Everybody knows they go in the office and they get the blue light shone on their tooth and it hardens the filling. So light activates a compound, right? That's how that works. And I had no problem engineering wise understanding the principle. But when it came to light on the human body, no way. That didn't make any sense. Just shine a light on something. But when I met up, because of my wife's illness, I met up with this one doctor and he turned to me and asked me what I did when I was trying to help my wife. And he says, "What do you do?" And I says, "Oh, I make this powerful blue light that hardens the fillings." I was actually the first one on the market with 3M to have the high power blue LED device for dentists. So I really did understand light technology at the time, how that would work. So, anyways, I understood that part. And he said to me, "Can you make it in red?" I'm like, "What the heck? Why red?" And he says, "Well, red is the right wavelength to photoactivate a drug that kills cancer." And it's called photodynamic therapy. And unfortunately, it's not where it should be today because of tremendous pushback. As you can well enough imagine, this could help in the cancer front big time. And we tried everything to move it forward. But that's how I got first involved with high power LED light. And because I really understood it well, I said, "Look, I can build you a light that we can very, very powerful, that can photo activate the drug." And this doctor had one of his patients was not doing well with the normal stuff. He had a tumor on his neck, and a woman with breast cancer. And I said, "Look, the day that I arrived there, just with my wife, was the same day that he decided that he was going to go buy 10 red laser pointers and put them together with elastic bands. Like, that's crazy." So I said, "No, no, no, listen, I'll build you something else." So we built them light. It shrunk the tumors in a month's time. It shrunk the tumors on both patients. And I really thought that was the direction that I would head for the next, and I did. I kept that going on another company. But the red light that I made, I thought at one point I had the severe back injury from falling off a ladder, second floor height. And I thought when I got this light back from him to do a little tweaking on it, I thought, what the heck, I'll try it on my back and see if it does anything. Because I was in such pain. I was probably an 8 out of 10 in the pain score. And when the pain is just screaming at you. And I thought, I'll try this very powerful water cooled light, LED light, and try it on my back with no drugs, just the light alone. Okay. And in about 20 minutes, my pain had reduced from about an 8 to a 3. And that's when I realized that light could actually help the human body, help people with pain. At least it helped me, but I thought there's got to be more people. And that was the start of the quest. And that's how I got going. But the big thing about it was I needed now very powerful light somehow, and that was the quest, to figure out how to create a very, very powerful light that was simple to use and didn't require water to cool it, because I used a water cooler for the for the cancer light with a pump on it, a circulation pump with water to cool the LEDs, because the LEDs are so concentrated they produce a lot of heat. So that's what I ended up doing there, Evan.
Wow, what a story. Irma?
Yeah, I have a question for Hayman. For people hearing photobiomodulation for the first time, how do you explain what's happening in the body with this technology, maybe in simple terms?
Sure. So photobiomodulation is the clinical term now for clinical grade red light therapy. So if you're curious about whether a condition is going to be helped by red light, always type in photobiomodulation along with the condition. So if you break it down, it just basically means that light impacting the bio and modulating in some way. So if you want, the simplest way to think about it is that our cells, just like trees, can absorb light and convert it into energy. So specifically the mitochondria, that's what we're talking about. So sunlight in specific wavelengths, like that's why, remember the whole trend now is people are saying, go outside in the morning, right? Get that first red light, because there's a lot of evidence for it. Like there's a lot of evidence for that red light impacting our cells. So mitochondria specifically have absorption of red light in between around 600 to 1100 nanometers. And that light can actually energize our cells. So in particularly mitochondria. So think of it this way. Most of us, it's like a battery that's being undercharged. But when we go out in the sunlight, we charge our own cells. And that charging our cells actually boosts the function of that cell and also allows certain pathways to get activated. So certain pathways that everything from regeneration, transcription, get woken up, right, with all that light and energy. And that's the simplest way to explain it. So and anyone who's interested, just type in photobiomodulation. That's all the latest research you'll find. And there's countless research articles out there.
Fantastic. Yes, that was a new one for me. I was a double E in college, so biology was definitely not my wheelhouse. But Tom, I mean, Irma and I used the products briefly at CES last week, and it was fantastic. Here's a picture actually of Irma and Hayman at CES just on the show floor trying it, and it attracted quite a crowd and definitely made us believers. We'll talk about our personal brief experiences. But, tell us, Tom, when it comes to customers asking, what separates real biomodulation technology from just the red light hype that's out there on every corner and every street. And Amazon, you see red light therapy of various kinds. What separates you on the clinical side from the hype that's already out there?
So, three things that are necessary to get light deep enough into the body is one is power. How much power do you have on the surface? Total power. Another thing is area, is very, very important, and wavelength, and also the tissue that you're penetrating. So one of the things that distinguishes us from the rest of the crowd is we have a medical grade device that we made in North America and we put make it in such a fashion that it puts out a lot of light, as you saw, a lot of light energy, as you saw, and it's putting it out over a large area. So that so what that does is if I took let's say a powerful laser and I put it on one spot, you could only stay there so long, so you'd have to keep moving it. Otherwise, you're going to burn that spot. But what we have is a lot of power using powerful LEDs over a larger area. So it does not have to be moved or anything like that. But what with the area, the more area you end up having, the more light or deeper that you penetrate. So you end up with more light energy on this side of my hand if you start off with just a small little area. It's not going to be as effective as a large area. And then a large area, we want as much power as we can. So as you know, you've seen, the amount of optical power goes right through my hand here, as you can see it on the red wavelength. And when it comes to the near infrared wavelength, this one, you can see it, some dots. It doesn't look very impressive, but that's a wavelength that our eyes can't perceive. So with that wavelength, 810 or 1050, depending on the model, we can get much, much deeper. And that's key. So it's really about power density and area for those EE terms. It's how much energy can I pump in this side. When I pump in so much energy on this side, on the other side, I have still some energy coming through. If I start off with a very small amount, not much ends up on the other side. And this is really, really important when you're talking about trying to treat something deep, a hip, a joint, like a shoulder joint, the brain. You need a lot of optical power, because as it goes through the tissue will start eating up the energy. So you need more on the surface to get deeper in. And that's people don't realize how important it is to have a lot of optical power. And then what sets me apart is I've come up with a patent pending air cooling system. I have a number of patents up to my name. People can look that up. But this is a patent pending air cooling system that allows me to have this amount of energy without one of those big, remember the old aluminum heat sink things that used to have? That's what this, can you imagine having a 10-pound heat sink on the backside of this? No, this is what I've been able to come up with, so I can cool these LEDs. And because they do produce heat, they're only 25-35% efficient. So all the rest is heat. So if I put a pile of them close together, they're producing a lot of heat. We got to get rid of that heat.
Interesting.
Hayman,
So it's medical grade.
a lot of medical grade.
Sorry.
So Hayman, so many potential applications. From a clinical perspective, what's the area where you've seen the most consistent, repeatable results so far?
Yeah, actually, I've been blown away. I'm a physician, MD, trained in physiatry, so physical medicine and rehab. I've done everything from rehabilitation medicine in sports, brain injury, amputee care, general sports medicine, geriatric care. And I never knew about red light, right? I knew about red light for heating, but not in photobiomodulation, like actually healing and energizing cells. I never knew about that. And so I've been blown away. I've been blown away by the actual. I'm going to try to move a little bit closer to the Wi-Fi here. So I've actually been blown away by the impact that it actually has. For instance, shoulder pain. Frozen shoulders are one of the hardest things to treat in medicine, especially for the elderly. So typically what we do is cortisone injections. And then we do rehab. I've actually had red light, like Tom's red light product. It's the strongest, right? So I've actually placed it over a patient's shoulder and immediately had that patient improve their range of movement without any injections, just a 6-minute treatment. That's it. So that, for instance, that sports medicine, musculoskeletal pain has been the biggest area that I've seen the benefit of. So that's musculoskeletal issues. So everything from knee pain, shoulder pain, joint pains. Now, the other area that actually has a lot of evidence in photobiomodulation is in oral conditions. So dentistry actually has a lot of research, especially in oral mucositis. So patients who have actually gone chemotherapy, radiation therapy, tend to have a lot of oral lesions. And so that actually, they actually have a lot of evidence for that. And they've done countless research. And there's actually recently, actually Tom could explain, is that the American Dental Association approved 2 billing codes to use photobiomodulation in dental practice. That's huge.
Yep.
Additionally, other areas that actually red light therapy helps with, that has research, is wound care. So I've seen it in action with patients with decubitus ulcers, so that's bed sores. Actually, the wounds heal much faster. And also there's some research to suggest that if you do red light prior to surgery, the wound healing at the incision site is much faster. So that's huge. Additionally, amputee care can be improved significantly. Now, the other areas that actually have more and more evidence is concussions. And there's several studies that have come out that shown concussions, and we've seen it ourselves. For instance, I've got a semi-professional hockey player friend who was heavily into drugs, marijuana use, everything else. But after he started using just the helmet once, I just begged it, please try it. I'm just testing out this helmet. Please let me try it. And he just tried it. And the next day he calls me back and, Hayman, what did you do? Like, I slept well, and I've not needed any of the marijuana stuff today. I reduced the dose. So it's huge, right? And so concussions, we've seen a huge effect as well. And there's so many other conditions like migraines. We could actually stop a migraine. Now, doesn't mean that every migraine is going to be helped, but so far we've helped anyone who comes up and goes in the helmet right after a migraine or uses the palm. We've seen the migraine actually just stop. And if you have an aura, if you have a person with a migraine aura, like some premonition of the migraine coming on, if they place the palm over the site of where the aura is, they typically don't have that migraine that day. So that's another area. Stroke patients, so aphasia. So aphasia is a condition where patients actually have difficulty speaking, right? So we know that the brain area that controls speech is on the left side, the parietal area. And if you put the light over that area, we found that the patients start speaking much faster. Now, one interesting area that I've been working with a QEEG specialist and a neuromodulation expert on is autism. So autism is some area that there's not much research, but we're doing the preliminary research for it. And we've seen kids actually start focusing better. They start talking earlier. This is after a few treatments. It's just mind-blowing, honestly. It's also really satisfying to see these effects fast. And I think to speak to Tom's point, like Tom's devices, this is the thing, like his devices are very strong. So they actually get the results really fast, and you see it. Like you don't have to wait days for it. You see it in minutes. So that's just some of the conditions. Now, there's so many other indications for this. There's everything from gut health to vagus nerve you could do. And these are all areas that I'm looking into, like protocols with Tom and a couple of other researcher people who have joined on. We're looking into different areas that photobiomodulation can actually help a person. Now, one area that actually significantly, Tom could actually speak to this as well, and I presume you've also experienced this, is that sleep is one area that improves significantly with the helmet. That's one common thread that we notice with every single person who actually goes under the helmet. The next day they'll say they had the most restful sleep. And that's a common thread with all our users. So typically, to answer your question, it's mostly muscle pain, inflammations. Think of anything that has inflammation, red light will help.
It's amazing. And, Hayman and Tom will come to you, but there's so much cynicism about emerging and new medical and health technology. There's a lot of disbelief because there is a lot of snake oil out
Right.
there. And you're the opposite of that. You have well established science behind it, but you are actively teaming with others and learning and testing. Where does that stand in terms of the science enlightening us as far as the benefits?
Yeah, so one of the things obviously is to prove the light can, in a study, a good study that shows that light can make a difference. We've been able to work with some one of the universities, Shepherd's University in West Virginia, that was able to show the opiate addiction and depression can significantly be affected and improved upon, so that the person feels less depressed, less anxiety driven, better outlook in life, less desire for opiates. So that's just one university. We're getting close to launching a number of studies at different universities, different locations. Some have started just as case studies, but all of this will show that not only can we have an effect on the body for pain and inflammation and speeding up healing, but we can also look at affecting the brain for strokes, concussions, traumatic brain injury, autism, Alzheimer's. Matter of fact, one of the gentlemen, one of the doctors out of Texas, he's looking at starting an Alzheimer's study. And another one is looking at long COVID, the effects of long COVID on the brain, and how we can change that. But we've already seen that firsthand, personally, anecdotally, already. But now we need to have some more proof, because some people will just look at Evan and say, "Hey, it got rid of the pain in your shoulder. I want to use it for my shoulder." That's all they need. And you get somebody in the medical profession, and they'll say, "Give me 10 studies that shows it helps with getting rid of pain in the shoulder." And we got people using it for their eyesight, and the skepticism there. But hey, when you can take, right now we got 3 people that were totally blind that see, and they, one was diabetic retinopathy that was a whole 3 years that was total blindness. So these kinds of things. Another one was 95-year-old with just retinopathy, but totally blind and now sees. And we got another woman that's got diabetic retinopathy, and she could only read the top line of the chart, the big E, and she couldn't even read that. She had a problem reading that, and now she's reading 5 lines lower on the eye chart.
And also to add to
it
Tom's,
almost sounds like a miracle. Go ahead.
I think we're working in the miracles. I won't discount that. I think we're working in some miracle space here, because who am I, Evan, to come up with this stuff? Like, I'm very glad that I can be a tool to bring healing to a lot of people. And we hope that it's healing of the nations is what we're looking at trying to accomplish here.
Wow. So it sounds like both you, Tom, and Hayman, you were both somewhat skeptical initially of the whole idea of the light therapy. So question to either of you or both, what is the most common misconception you hear from people that are new to light therapy?
Tom, you want to go start first?
Hayman. Okay, yeah, all right. Yeah, I guess the common misconception is, that can't work. How is that supposed to work? Or how is light going to penetrate with any depth? So those are the common ones. And I think, it's some people that are really looking at their own health in the wellness space, trying to get better on their own. They're probably the easiest ones to take the step to believe and try and see it work. It's those that are limping and saying, how's that supposed to help me for my limp? And then they continue. I even had you mentioned WE in your background, but I even had very well off businessman who came down. He was having a trouble remembering things. And so he put anyways, I put the helmet on him, and he says, I don't see how this is supposed to help. I'm not remembering things well, but so that's just been happening more recently. 6 months later, he was diagnosed with dementia. And my good friend loaned him his helmet for him to use, this guy. And he started using it. He's journaling every day. He says
Wow.
he can't believe how much improvement he's had in his cognitive ability. And now my buddy says I'm going to tell him he's got to buy his own light, his own helmet.
And
So
and the
Hayman, you
hardest
got to.
part is also competing, right? Tom, the hardest part is also competing against all these other red light products out there. The market's
Oh yes,
flooded right now with red light products, but the problem is most of them are so underpowered and they don't get the actual effect you're supposed to get. And so patients, like people actually, desperate. A lot of people are desperate for solutions. They go try these out and they have this negative perception that, oh, I
or
tried
they
it, it
buy
doesn't
them.
work,
Yeah,
right?
yeah.
And doesn't try it, and then all it takes is just them going under one of Tom's products, and they realize, whoa, this is totally different. I've had people who've used like some of the most expensive beds, like $200,000 beds, right? These are the red light beds. They would try that, and then they would actually try Tom's mini canopy, and they will go, "This is totally different. I feel
Mm.
this. That one I don't feel." Right? And his mini canopy is only 5,900. And also to the earlier point, to your viewers, like the business focused viewers, the dry AMD, dry age-related macular degeneration. It's an eye condition that actually has been clinically proven to be treatable with red light. And there was a company that was bought by Alcon for $500 million just for doing red light in the eyes.
Mm.
And that was a very
Just
low-powered red light. And Tom's
just for
device,
the
all you do
eyes.
is take the Palm device and do the same thing, right? With the evidence, we could do the same thing with his Palm, 30 seconds, and you get the same effect. And his device is only $1,300. And this company that got bought over is $500 million worth now. It's like Alcon owns them. So it's there. The technology is being realized, and the market's opening up. But unfortunately, the misconception is that there's so many devices out there that are so underpowered that people don't really get to feel the real effects. Just like food, right? A lot of people don't know what real good, maybe certain foods are because they're used to all these fast food chains, right? And so they actually think that that fast food chain is what food is supposed to taste like, when in fact, if they go to a mom and pop shop, right, that makes the real genuine food, and it's not that expensive, they actually get to experience that real good food. And that's what this is, real, pure, good photobiomodulation light that made by SunPower.
Yep.
Fantastic.
Well, as
Irma?
we, yeah, Heyman, as we look ahead a few
Yep.
years, where do you see the photobiomodulation becoming truly mainstream? Clinic, home, sports settings, or something else entirely?
Yeah, so I think it's all of the above. Basically, there are different grades as well, because we have to be also cautious that some of the red light, like we know that red light so far, from what we know, is that it does not cause harm. Like we haven't seen any harm because it's been studied for a while. But then again, that being said, we still have to be careful, because what we have realized in our studies so far is that sometimes even like some people use frequencies, like with light, you could pulse it. And for some brains, sometimes pulsing may not be adequate. So for that cases, there's certain situations where you have situations like epilepsy or mood disorders. It's better to have it in a clinic setting where they actually can be assessed and then prescribed the proper light. But for most other conditions like musculoskeletal, everything else, it should be such a simple thing. You just pick it off the shelf and do it. Like in France, for instance, or Europe, you could actually buy nasal devices. Like whenever you get sinus infections, that you get this
Mm.
little nasal cannula with red light in it. You just pop it in. It's 20 euros. You go to any pharmacy, you could buy it. Pop it in your nose, and it actually clears up your sinuses. And that does it. We know it. We know it does. All you do is take the palm or a light and put it over your face, and it just clears up your sinuses, just like what Tom's doing there. It's
That's
amazing. So
amazing.
it's making into the market, and hair treatments, we've seen it, facial treatments, it works. But
Oh,
again, it's a time, right? It's a time that you use these devices. Most of these devices you need to wear for 30 minutes twice a day and for several days to even see an effect. For instance, like with SunPower LED, the power is so much that you could just get the same effect within a few minutes and you get on with
that
your life,
is
right?
that is amazing, and we can't wait to try the device. You've been kind enough to send us one for our own personal consumption, friends, family. So we're going to report back on our own little clinical study at home. But before that, just final words, Tom. On a personal note, I know you're a very religious person. I'm not very religious, but I do know that Jesus was a healer. Is
Yeah.
that part of your inspiration as far as getting this out to the world?
I would say because he was able to heal the blind and the lame and the mute, and those that have epilepsy, and we've been able to see some of those beautiful things happen as well. So one person couldn't speak at all for 2 months, and they ran through every test they could figure. They started using the light, and then they started they got their full speech back. And we've got, like in autism, when you can have a young boy say mama for the first time because he couldn't before. Those are pretty major things, and it's a lot of fun. Enjoy a lot of enjoyment to see people get better, and we hear about it from around the world now. And the biggest thing right now is Evan, we are looking at a raise. I've not needed a raise ever. We're cash positive. Everything is going very, very well. But it's a time that we're looking at. We've not had investment. All the investment is everything I could pouring back into the company and running on a shoestring. But now things are really growing to the point where different places want studies to happen. And so we're looking at like a $10 million raise to help us to get this stuff documented and proven in a real study format, a good study format that shows that for different, so we can actually say this helmet can treat autism, or this helmet can treat epilepsy, or this helmet can help with Parkinson's. We've seen the anecdotal information and a fair amount of it, and we're not scared to even try it on anybody, just like Hayman did when he just showed you right then and there, because it's safe. It's very, very safe, and at the same time, I don't know, Hayman, I think every time we do it, we expect results, sometimes even on the spot, like, with pain in the shoulder or hip, or, a neurosurgeon that I'm working with right now, he says, is it a placebo effect? But I put the light on my thumb and the pain went away in a couple minutes. Like, he says, that's crazy. I says, that's what I would expect.
Well, Irma and I may need to open our own clinic in Boston just for our friends, family, and followers here on social media. But that's another topic. Thank you, gentlemen, for joining us. I think there'll be a lot more information, discussion to come. But I think for now, we just say thank you. And for everyone listening, check out SunPowerLED and check out their products and solutions, and do some research on this incredible new, not so new technology in the red light spectrum. Thanks, everyone.
Thank
you,
Tom,
Evan
Hayman.
and Irma.
Thank you, everyone.
Thank you, Evan
Bye-bye.
and Irma, putting this on. Thank you very much.